Hi, everyone. Thank you so much for joining me today for this webinar. I'm really honored to be partnering with the Muscular Dystrophy Association to talk with all of you today about healthy tips and strategies for caregiver mental health. I hope that you will find this information helpful, and please take note of any questions that you may have throughout this presentation, because we'll definitely have some time at the end for questions. We have a lot to cover, so let's dive in. First of all, why is this so important? I really want to recognize that all of you have extremely important roles in the lives of your care recipients with neuromuscular diseases. It is your efforts, your time, your energy, and your compassion that directly helps these individuals lead fulfilling, normal lives. I know firsthand that it can be really hard to lack the independence of being able to take care of yourself. And I want you to know that it is because of all of you as caregivers, that make it easier for people with neuromuscular diseases to lead a fulfilling life. All of you play an extremely vital role in helping your care recipient feel more comfortable in their daily care. But at the same time, we have to acknowledge that caregivers are humans too. And it's very challenging for caregivers to usually balance the needs of their care recipients along with their own needs, including their own comfort, wellness, and their overall mental health. It can be really common for so many caregivers to struggle finding this balance. So if you are listening and if you have ever felt burned out, exhausted, or generally a bit drained due to some of your caregiving responsibilities, you are certainly not alone. You may feel like you don't have enough time to focus on your own needs. You might have feelings of guilt when you attend to your own wellness, or maybe you struggle to speak up and ask for what you might need. Today, I want to explore all of these things, and we'll talk about some of the barriers to your own wellness that you might be facing. I want to leave you with specific tips and strategies that can help restore your wellness and allow you to achieve a better life balance. So first, let's talk about some of the barriers. I want you to really think about the following questions. Take a moment to reflect and ask yourself if you have ever felt this way. Do you ever have feelings of guilt or think that you're being selfish in some way if you prioritize your own needs? That can be really common. Do you ever find it frightening or scary to think about your own wellness? What is that fear about? Where does that come from? So sometimes it can be really scary because we might be really afraid that we don't have time for it. We might start to feel a lot of anxiety or even depression if we feel like we're not getting enough time for ourselves. So think about if you have feelings like that and where that comes from. Are you afraid that other people, whether it is your care recipient or other people in the family or their family if you're not part of the family, do you ever fear that any of these individuals might perceive you in a negative way if you focus on your wellness? Are you worried about what they may think? Are you worried about your care recipient individually becoming upset if you take time off or if you step aside to take care of yourself? Do you ever have trouble asking for what you need? So this is something that may have been true for you even years prior to your position as a caregiver. Have you ever felt like you are in some way inadequate or not worthy of asking for help? I know that's a really loaded question, but kind of take a moment here to think back on how you took care of yourself prior to the role of being a caregiver. Do you ever feel like you have to prove that you're worthy of your care recipient's affection or the family of your care recipient? Does that ever lead you to taking on too much as a result? What would you say is the biggest reason preventing you from self-care? Again, that's a really loaded question, but take some time to think about that, because if we can slow down, pause, and truly reflect on what are some of the biggest reasons that are preventing us from our self-care, that can be really helpful in addressing it. So think about that. Is it time? Is it resources? Support from others? Lack of other caregivers available to step in? Have you ever generally struggled with prioritizing your mental health, even prior to the role of being a caregiver? Or have you ever struggled with mental health conditions? Have you ever just had a really tough time with anxiety, depression, relationships? How is your mental health? And this may be something you reflect on, not just in the current role of a caregiver, but throughout your life. What generally helps you sustain your mental health? What generally makes your mental health feel worse? What helps you feel like you're living your best life? And what makes you feel really exhausted and drained? What are some of those specific things that help you, and also those specific things that make you feel more and more exhausted? Do you ever have any negative self-talk or internal beliefs that make you feel as though you're not deserving of prioritizing your wellness? So this can be really important because if we already struggle with self-esteem or confidence, or if we have a really hard time believing that we are worthy and deserving of prioritizing our wellness, that's going to make it really, really hard for us to maintain our wellness. So reflecting on these questions is an excellent starting point because, like I said, it helps you identify what personal barriers are contributing to your feelings of burnout or exhaustion. No matter what your barriers are, I really want you to know that you are not alone in feeling like this is really hard. You're not alone in feeling like sustaining your own wellness as a caregiver may be very challenging or inaccessible to you. Many caregivers feel like it is not possible to prioritize their mental health given the barriers that they face and the overall demands of their caregiving responsibilities. But the truth is, there usually is at least some way for caregivers to slowly take steps to restore their wellness. That is so important because we can't pour from an empty cup. We can't give our energy and attention and compassion to other people if we are running on empty. It's just not possible. And it's actually going to really affect the quality of the care that we are providing and also the relationship with your care recipient. So let's talk about stress management. As you are all probably very much aware, caregivers are not exempt from stress. So you may be perceived as a strong, unbreakable, superhuman caregiver that is capable of handling everything all the time. But you probably know on the inside that that's not true. Even if other people see you that way, or you have this reputation of being the one that can always handle everything, remember that it's okay to let people know that you also struggle with certain things, because nobody is a robot. You're not a superhuman robot. You are just a person. You are a human. And like all humans, you are allowed to talk about the things that you are struggling with. I don't want anyone listening to this to feel like it's not okay to be vulnerable or to share with others that you really might be struggling with burnout. Sometimes just opening up about what you're feeling to safe people that you can really trust can be very helpful, and it can allow you to feel an immediate sense of relief. Beyond the actual caregiving responsibilities, you may experience high levels of stress because it can be very emotionally taxing to witness someone that you love or care for struggle with severe physical impairments due to a neuromuscular disease. You may be involved in the medical life of a person with a neuromuscular disease. You may be very involved in making decisions about equipment or treatment, or you may be accompanying your care recipient to all different types of health appointments, which can definitely be emotionally draining to think about everything that your care recipient is going through. You may also have a high level of stress over time as you become more and more aware of the disability barriers in the community, employment barriers, or social barriers that impact the life of the individual that you are caring for. It's really hard to care so much about someone and to feel like it's not fair that you may have certain access and freedoms in the world as an able-bodied person, while they may be facing more oppression and limitations due to social inequalities or due to inaccessible buildings or spaces in the community. So sometimes it's not simply just the caregiving responsibility of helping a person shower, get dressed, use the bathroom, or do day-to-day things, but rather it can also be stressful for caregivers because of these additional social and emotional factors that lead to greater levels of stress. So take a moment to reflect on your feelings and your thoughts that you have felt in your life as a caregiver. Productively dealing with the stress that you may be facing starts with attending to your basic needs. So I want to talk about basic needs because this is the foundation. This is the bottom of the pyramid. This is where we really have to make sure that we are meeting our basic needs before we can even think about enjoyment, hobbies, travel, laughing, getting along with people, having fun. Before we can think about those things that elicit joy and relaxation and that make you feel very fulfilled and alive, we have to think about the basic needs as a starting point. So when we think about our diet, it's important to think about, are we getting enough adequate nutrition? It's important to prioritize eating a well-balanced diet, so make sure that you're enjoying a variety of foods. Make time for every meal. Your body and your mind need fuel. There's no way that you can be a caregiver all day, every day, or whatever the responsibilities that you have are, whether it's part-time, full-time, whatever you're doing. It's going to be really hard to sustain yourself if you're not keeping up with making time for each meal. You also want to listen to your body. Avoid overeating or undereating. So sometimes when we get really, really stressed and overwhelmed, we may develop habits like always comfort eating, like running through fast food or binging on certain types of junk food. And that can be really detrimental to our health because then it becomes a habit and we may not have adequate levels of energy or stamina if we're always just overeating and putting all of this junk food into our body. On the other hand, some people that get very, very, very stressed out and who really struggle with anxiety or depression, they may actually lose their appetite or they may just not be eating enough. So people that are under eating are also going to have health complications because you're probably not going to have as much energy. Your body may be more at risk for acquiring illnesses like the common cold or flu if we're not eating enough and we're just running on empty. You may also want to try meal prep on the weekends. So prepping meals in advance can help limit that added stress during the week. It might just be easier if you have food already made, especially after a long day. Sometimes at the end of the long day, you may not want to cook dinner or worry about taking a lot of time to prepare a healthy meal. So meal prep on the weekends could be a good idea. And of course, you should always try to limit foods that contribute to extra stress and anxiety. So having too much sugar or excess caffeine or too many greasy foods, sometimes that can be really negative for our bodies because it can contribute to higher levels of stress. In terms of exercise, you're going to want to make sure to get your body moving for at least a few minutes every day. Getting enough physical exercise releases endorphins, which help with stress. So it's really good to do exercise and whatever you have time for. It doesn't have to be, running for miles every day. You can simply do something more simple and fun. You can make it fun, like try yoga or dance for a few minutes every day. Try sports or simply, play basketball in your driveway or kick a soccer ball in your backyard, either by yourself or with others. Making time for exercise is also healthy because it distracts you from your worries and it adds that structure in your life where you can just have your outlet. You can have this physical outlet to release the buildup of energy inside of you. You can also incorporate your favorite music to boost your energy and mood. And it's really critical to let go of perfectionism. You don't want to compare yourself to others. It's not helpful, and it's probably just going to lead you to putting yourself down. So if you go to the gym and you have a tendency to compare yourself to other people, try to let go of that if you can. Distract yourself with headphones or whatever helps you remain focused on the exercise that you're doing. Remember, you don't have to do this perfectly. Just getting a little bit of exercise can sometimes help people manage stress. And the third basic need that we'll talk about here is sleep. So we have to prioritize sleep because it gives our bodies and our minds time to restabilize. You want to try to be consistent with bedtimes and wake-up times. Following a healthy routine is so critical. Following healthy routines is proven to help people manage their stress level. You also may want to ensure that your bedroom is quiet, dark, relaxing, and at a comfortable temperature. Some people that struggle to fall asleep at night find that avoiding electronic devices before they go to bed helps them relax quicker and helps them fall asleep more easily. So this would mean avoiding your phone, television, computer, tablet, things like that. You might want to create a bedtime ritual that works for you. So really take some time to think about what would relax me before I go to sleep. What do I find relaxing? What could I do? What could I change in, the 30 minutes or the hour before I go to sleep? Is there anything that I could add? You might want to consider essential oils, stress relief products, candles, soft music, nature sounds. I know I personally love listening to my sound machine, and I'll just put on thunderstorm sounds or ocean waves. That can be really relaxing. You may also want to use herbal tea, mindfulness exercises, reading, journaling, warm drinks, or a weighted blanket. And if you find that your insomnia becomes really unmanageable, if you're finding that you're just really having a hard time sleeping and nothing seems to help, don't be afraid to talk to your doctor. When you're a caregiver, you are using a lot of energy every time that you provide care. It's a lot of energy mentally and physically in your body. So it's critical that you're getting enough sleep and you're getting quality sleep. If you're having a hard time with that, please talk to your doctor. There will be options and things that you can try medically to help you get to sleep faster. Next, let's talk about prioritizing self-care. Even if you only have 5 minutes every day, there are ways that you can prioritize a little bit of self-care. Prioritizing self-care means that you're giving yourself the same compassion and the same care that you give to others. It's about being gentle with yourself, being kind to yourself, and choosing to do things that are going to help you alleviate some negative stress or energy inside of you. Self-care can look very differently for different people, depending on what activities you find to be the most helpful in relieving your stress. Understanding what self-care activities work best for you may mean learning more about yourself and getting curious about what helps you and what doesn't. Often we have to go through some trial and error to figure out what works best for us. This can mean exploring lots of different activities to de-stress, holding on to the ones that work and throwing out the ones that don't. The more that we practice intentionally making time for our own self-care, the more resilient that we become, which ultimately helps strengthen our ability to cope with distress, and it helps us manage whatever comes our way. For caregivers especially, it's so important to find even just a few minutes every day, even if you only have just a couple minutes, because this will help you manage the demands of caregiving and the related feelings of burnout with your role as a caregiver. So just a few ideas on this slide for what you can do in just 5 minutes, because I know that you may not have a lot of time on your plate. So in 1 to 5 minutes, you can breathe, you can meditate, you can step outside, you can say no to something, you can listen to a favorite song, close your eyes, stretch your body, drink some water, text somebody, make a list, doodle or color for just a couple minutes, look out a window, watch a YouTube video, wash your hands, put on lotion, dance to a song, hug someone, daydream, have a quick snack, pet your dog or cat, use a stress ball, change your clothes, get something more comfortable on, use a calm app on your phone, play a phone game, pick out a movie for later, try a yoga pose, look at a picture that brings you a good feeling, water your plants, grab a blanket, light a candle, find an inspiring quote, book an appointment for yourself, compliment yourself, read a poem, create a goal, do nothing. Sometimes it's just good to sit. Just sit down, close your eyes, and just relax. Just notice your body relaxing. Write down a happy thought or look at a funny meme or joke online. And if you want to work on how you may be able to get more time for yourself, and if you feel determined to figure out ways to have more time for your own self-care, let's talk about some questions that you can ask yourself that may be helpful in achieving this. So first, ask yourself why you don't have time. Is there anything that you can minimize in your life? Can you let go of anything? Is it possible that you might be taking on more than what is necessary? Are there any unrealistic or unreasonable demands in your life that should be addressed? Can you ask for help from anyone to create more room in your life? How might you network within your social support system to seek greater help and assistance for your care recipient? Are there any local resources that you can utilize for additional caregiving help? Why hasn't your mental health been made a priority in the past? Can you arrange for specific time blocks just for you? What changes might be a possibility? So either with yourself or with a therapist, if you need additional support, talk about these questions, reflect on these questions, and see what changes might be possible. I really want you to remember that self-care is never selfish. I don't want anyone to mistakenly believe that taking care of yourself is by any means selfish, because it's not. In fact, like I mentioned earlier, how can we possibly take care of other people if we're running on empty? The truth is that we all have mental health needs that we have to take care of, and if we're neglecting our own self-care, then we are more likely to become resentful, exhausted, or totally burned out, which is not going to serve anyone well, and will likely cause for a lower quality of care that you're providing, which is not good for the person or for you. Self-care helps us recharge our batteries so that we can show up for ourselves and for others, like your care recipient, in authentic ways. Both of you will benefit so much from your commitment to wellness. Now I want to provide you with a ton of coping skills. These are a lot of my favorite skills, and I want to provide you with this list because sometimes we forget about the basic things that we can do to help us cope with a problem or a challenge in our life. If somebody were to ask you, what coping skills do you typically utilize? It might be hard for you to articulate or describe how you cope with things. Coping skills are not something that we really talk about that much in the world, but we talk about it a lot in the mental health field. So as a therapist, I'm always talking about coping skills with my clients, and I just want to present to you a bunch of my favorite coping skills. These skills are not necessarily specific to the role of a caregiver because they can be beneficial for anybody that is feeling burned out or frequently stressed in some way. But remember, as a caregiver, you are probably facing higher levels of stress than the average person who is not engaging in the role of a caregiver, which is why these coping skills are so critical for all of you as caregivers to practice. And as I go over the list with you, think about how you might integrate some of these coping skills into your daily life. So these are my favorites. Take a break by detaching yourself from the source of stress in your life. Exit the stressful environment for a moment. Just step aside, walk away, say that you need a moment to have a break. Break down big problems or big responsibilities into just very small, more attainable pieces. Make a list of what you need to do. Making lists can be really helpful. Check off just one item at a time. Identify anybody in your life that you can talk to or that can help you with the problem. Remind yourself of the bigger picture. Will this matter in the future? Adjust your standards and expectations. Are you asking too much of yourself? Take a moment to practice gratitude and introspection. Do some deep breathing and find something that you can see, hear, touch, smell, and taste. Let go of the things that you can't control. Remind yourself that nobody has all the power. Look for the upside. Look for the silver lining. What can we take away or learn from this experience? Try to be more accepting of imperfections and allow for mistakes. Visualize a positive outcome. So try to imagine things turning out well. Find a way to bring humor into the situation. Make a list of pros and cons for difficult decisions. Write a list of your personal strengths and characteristics. Consider challenges as opportunities to grow. Brainstorm solutions and write down your next steps. Practice assertive communication to express what you need. Show yourself appreciation and self-compassion. De-escalate your emotions by reminding yourself that stress always passes. Look for the gray areas. Can anything become more flexible? Step back to assess if anything is being overgeneralized. Determine if any deadlines, decisions, or dilemmas can be delayed. Reflect on the worst-case scenario and assess the likelihood of that. Identify any faulty thinking and challenge your perceptions. Normalize your symptoms of stress and remember that you are human. Acknowledge your emotions instead of ignoring how you feel. And allow yourself space and time to decompress from frustration. I also want to emphasize the importance of expressing your emotions. To lead a mentally healthy and fulfilling life, we have to make sure that we have opportunities to express ourselves. This is especially important for caregivers because you may not always feel like you can express your true feelings when you are attending to the needs of your care recipient. It's very easy to fall into the trap of making that a habit, and you might slowly realize that you really don't have many opportunities to talk about how you feel. So if that's the case, you really want to work on that and try to find an outlet. You may also find yourself wanting to be strong for others all the time, but remember that it's unrealistic to expect yourself to never have any negative emotions. Suffering in silence and holding on to all of those negative feelings that are buried inside of you often leads to higher levels of stress, and you may develop anxiety, depression, or other mental health challenges. I completely recognize that some feelings are hard to verbalize, and sometimes we may have thoughts that we don't want to say out loud. But when we deny, avoid, or hide our feelings, we often feel isolated. Our emotions will build up or become worse, and we might experience feeling out of control. Avoiding self-expression can also put a strain on all of our relationships, and we are likely to feel misunderstood. And for caregivers, it will definitely impact the relationship that you have with your care recipient, which isn't good. On the other hand, when we are fully aware of our emotional reactions and when we have those safe spaces to express how we feel, we are more likely to feel a reduction of stress and develop confidence in managing our challenges. So overall, it's just really good to express yourself. It helps people better advocate for their needs, which is why caregivers in particular should always have outlets to express how you feel. You don't have to be strong all the time. It's okay to feel sad, discouraged, angry, or disappointed. You matter and your emotional experiences matter. Honor your feelings, whatever they may be. Remember that ignoring your emotions doesn't make them go away. Practice self-expression, even if it feels uncomfortable at first. And remember that your internal experiences are valid, even if they differ from others. I want to leave you with some motivation so that you can truly assess how you're doing and make positive changes if needed. So let's review some of the benefits that you may feel when you start to prioritize your wellness. When we take care of our mental health, we are more likely to feel more positive and experience more joy, reduce feelings of hopelessness and despair, develop goals and make progress toward them, establish better friendships and relationships, cope better with the unexpected challenges of life, work more productively and efficiently, and contribute more to our communities, which are all things that we should use as motivation for continuing to take care of our mental health. You always, always, always have the right to these things. As a caregiver, I kind of think of this as your Bill of Rights. These are the things that you always have the right to. You have the right to take care of yourself. It is not an act of selfishness. It will enable you to take better care of your care recipient. You always have the right to seek help from others. You have the right to recognize the limits of your own endurance and strength. You have the right to maintain parts of your own life which do not have anything to do with your care recipient, just as you would if they were not in need of caregiving. So when I talk about that, I just think that it's important to remember that one because a lot of us feel like when we are a caregiver to someone, it can feel like that becomes your identity. So if you're feeling that way, I just want you to remember that you are more than a caregiver and you have the right to maintain parts of your own life that don't include your care recipient. You always have the right to experience difficult emotions. You have the right to acknowledge that you are human. And you always have the right to take pride in your strength as a caregiver and to applaud yourself for the courage that it takes to prioritize your mental health needs. And I really hope that you do that. I really hope that you are proud of your strength because you make a tremendous difference for your care recipient. And it's really important to honor that and honor yourself and celebrate the courage that you are utilizing because it takes a lot of courage to do this job. So by now, you should have a lot of information that you can walk away with, some tips, strategies, and things to remember. But beyond just carrying this information with you, I really want you to actively reflect. I want you to take time to truly sit down and reflect and take note of what you might want to do next. So with that being said, I do have some final reflection questions for you. So I want you to take some time to ask yourself, how is your mental health? So really think about that question. Are you experiencing symptoms of caregiver burnout? Are you feeling exhausted? Are you having trouble sleeping? Are you having any symptoms of anxiety or depression? Do you have relationship concerns? Do you feel like you're able to manage your stress? Or do you find yourself feeling stressed out most of the time? What do you need to work on? So if you're struggling with caregiver burnout, please ask for help from the people closest to you and reach out to any local resources that may be able to help. If you're struggling with anxiety, you may want to look into some mindfulness practices or try meditation or yoga. If you're feeling depressed, you may want to think about what factors in your life feel most upsetting to you and maybe reach out to a counselor to work on recovery from that. I know that thinking about what we need to work on can be overwhelming, but I hope that part of you can also feel empowered because slowing down to identify what you need to work on and what will help you means that you are taking back control. And it means that you are being very intentional about developing positive mental health, which is very commendable. What strategies can you adopt? So what can you take away from this presentation to implement into your own life? How can you create time in your life to prioritize some of the strategies? How can you feel like it's okay to make time for self-care? How might you create small changes that can be integrated into your day-to-day life? Sometimes even just adopting one or two strategies can make a big difference for your wellness. Remember that making changes is a process. It doesn't have to happen all at once. And be gentle with yourself if you can't master everything right away. And finally, what are your resources? Do you have people that can support you as you take these next steps? Are there any caregiver support groups or programs that you might want to participate in? Do you have a healthcare provider who you can safely open up to about your mental health? Think about whatever resources that you have in your life that can be a part of your wellness plan. Remember, if you are struggling, to always reach out for help from a mental health professional. If you are feeling symptoms of burnout, anxiety, depression, relationship issues, feeling isolated, overwhelmed, or misunderstood, if you're struggling with unmet needs, or if there are any other mental health concerns, please don't be afraid to ask for help. We all have to take care of our mental health, and you are never alone. Thank you so much for listening to this presentation. It's really an honor to be partnering with MDA, and I'm so glad that I was able to talk with all of you today. I want you to know that I'm approachable and that you can always email me if you would like to. My contact information is listed here. Now, I would love to have some open discussion and answer any questions that you may have about caregiver burnout or mental health subjects in general.